Hello and welcome. I'm Uday Pratap Singh. You're joining us on this special broadcast. Prime Minister Narendra Modi has invited 10 prominent personalities from various fields to join a national movement aimed at raising awareness about obesity and promoting healthier lifestyles. In fact, he also spoke about the issue on his Mann Ki Baat program just yesterday. This initiative aligns with the Fit India movement launched to encourage citizens to adopt fitness as a key part of their daily life. This initiative is aspiring to create a lasting impact on the nation's health. Well, remember, eating habits in recent times have changed drastically. As the pace of our lives has increased, many of us often order food on the go. This has also contributed to an alarming trend, and India is now the third most obese country in the world. What's needed to control obesity in India? How do we become a more healthy nation? Well, we have some very erudite and well-known guests joining us on the broadcast today. But first, let's take a look at what Prime Minister Modi said yesterday on the issue.
साथियों, खाने में तेल का कम उपयोग और ओबेसिटी से निपटना यह केवल पर्सनल चॉइस नहीं है, बल्कि परिवार के प्रति हमारी जिम्मेदारी भी है। खान पान में तेल का अधिक इस्तेमाल हार्ट डिसीज, डायबिटीज और हाइपरटेंशन जैसी ढेर सारी बीमारियों की वजह बन सकता है। अपने खान पान में छोटे छोटे बदलाव करके हम हमारे फ्यूचर को स्ट्रॉन्गर, फिटर और डिसीज फ्री बना सकते हैं। इसलिए हमें बिना देर किए इस दिशा में प्रयास बढ़ाने होंगे। इसे अपने जीवन में उतारना होगा। हम सब मिलकर इसे खेल खेल में बहुत प्रभावी रूप से कर सकते हैं। जैसे मैं आज मन की बात के इस एपिसोड के बाद 10 लोगों को आग्रह करूंगा, चैलेंज करूंगा कि क्या वो अपने खाने में ऑयल को 10% कम कर सकते हैं, और साथ ही उनसे ये आग्रह भी करूंगा कि वो आगे नए 10 लोगों को ऐसा ही चैलेंज दे। मुझे विश्वास है इससे ओबेसिटी से लड़ने में बहुत मदद मिलेगी।
In fact, joining us now live is Dr. D.K. Gupta, let me draw you in here. Dr. D.K. Gupta, at the end of the day, of course, how concerning is this for you as a doctor? And do you see often, patients, having these sort of heart disease risks because of unhealthy lifestyle and because of unhealthy eating habits? Have you seen that trend grow in the last few years?
Thank you so much on being on board. I will tell you that obesity is one of the root cause for most of the lifestyle diseases like cardiovascular disease. We are losing millions of life yearly because of high blood pressure, heart disease and stroke. Millions of, around 25 to 26 lakhs people die in India only because of these diseases annually. Type 2 diabetes is one of the most common cause of like lifestyle disease, and type 2 diabetes also, like we are known as capital of diabetes in worldwide. We are having crores of people who are suffering from diabetes and pre-diabetes. We are having lots of joint problem, osteoarthritis. It's because of disease, because of obesity only. Respiratory problem like sleep apnea, breathing difficulty, even sudden death can occur because of this obesity and high BMI. Digestive disorder like GRD, acid reflux, fatty liver disease. As doctor already told you that every second person in India having right now grade 1 or grade 2 fatty liver disease. Mental disorders, depression, low self-esteem, anxiety, one of the most common cause of these sufferings from obesity and other lifestyle diseases. Reproductive issues. We are now having a pandemic, not a pandemic, epidemic of fertility problems in both men and women because of lifestyle disease, and one of them is obesity only. Lots of cancers are directly linked to the obesity, especially truncal obesity, that is around the abdomen. It means root cause for most of the lifestyle disease is obesity, and that has to be, I think, understood by everybody. And I think Prime Minister already created awareness amongst us, and now we need to focus on, now we need to do something to not eradicate. It is not possible to eradicate obesity. Even elimination is not possible. But definitely we can control obesity if we follow rules on our diet, lifestyle. If we do lifestyle modifications like we are doing, like he's already told about Fit India movement, where we need to do exercise and diet to have control all these diseases like obesity, diabetes, hypertension, asthma, COPD, increased risk. So definitely, I think lots of medical and non-medical things have to be done to control this obesity, especially non-medical things like we all know that currently the youth of India taking high level of processed food, sugary drinks, and unhealthy fats. I think that has to be controlled. Lack of physical activity. Most of the people in corporate and even households also, they are having sedentary lifestyle. They are not doing exercise. Everybody needs to do at least 30 to 40 minutes daily exercise and daily something cardiac exercise so that they can be fit and healthy. Most of the people in India also suffering from lots of genetic disorders that can cause obesity. There are hormonal imbalance like hypothyroidism and PCODs that is more common in females, especially the PCODs. Medication, most of several people, like several millions of people having dependent on steroid and antidepressant drugs, this can lead to obesity.